Couple warnings. The audio is a little messed up, so it's not like it's in sync, but it's not in sync, you feel me? So I apologize about that. Get down! Anyways. Having 2 cats and trying to record, or do anything, honestly, is just a nightmare. Can you not sniff her butt? What is wrong with you? Look, you're on the thing. Look, Willow. Vote for her. Please. Yeet, girl. Yeet. Yeah, the audio is a little, it's in sync, but it's not in sync, so I apologize about that. Secondly, but my boyfriend and I were talking about the fact that we haven't really heard anything about Luigi Mangioni. I'm gonna do a quick Google search. I have it actually pulled up. Give me a second. I was on LinkedIn. The first post I see is how Luigi Mangioni inspired trans women who tried to kill GOP leaders. That's the New York Post. Of course it is. Who would put that as a title? Apparently Dave Franco got texts about how he looks like Luigi Mangioni. I really hope I'm saying that right. Also, I'm on my period. This is the worst. I also have fibroids, TMI, but I do. And it's killing me. An update, this is from January 6th, ironically. He is unlikely to appear in federal court again before mid-February after prosecutors and lawyers on Monday requested more time to prepare for trial. I didn't know he was 26. That's crazy. He's younger than me. It'll be extended from January 18th to February 17th. He did plead not guilty, which correct, period. Oh, Mom, if you see this, yes, I'm drinking out of your Tweety Bird cup. I missed you. Even though you literally called me like probably an hour ago. The case is unusual because at least one charge carries the possibility of the death penalty, but whether to pursue that penalty must be made. Let me make sure I'm still recording. I am. But whether to pursue that penalty must be made by the Justice Department in Washington, where top officials will be changed as President-elect Donald Trump takes office later this month, because this is from January 6th, including the murder as an act of terrorism, which is crazy because that means that all CEOs of businesses are considered. That's just like, I never thought the murder of a CEO of a healthcare company would be considered an act of terrorism. So that puts a lot of other things in perspective, because it's like, okay, well, other CEOs of bigger businesses, any business that's involved with the government, I guess, would also be considered an act of terrorism if they were to be murdered, which is like such a crazy thing to think about, because it's kind of making the businesses people, which, I mean, there is a court case that does talk about that already, that businesses are people. That's what the Supreme Court ruled. It's always insane when I think about that. It's always kind of funny that he's in the same prison as P. Diddy and Sam Bankman-Fried, which I didn't know he was in there. And that P. Diddy is really mad that he's getting more attention than him. But it's like, you're in jail on charges that are like not great. You were never gonna be popular in prison, P. Diddy. But yeah, anyways, and a lot of the folks who are in prison shared their life stories with Luigi Mangioni. This Business Insider article, Luigi Mangioni came from privilege, then his spine gave out, he went off the grid and he got a gun. You guys are insane. Yeah, I'm not seeing anything on like how he's doing, just that his court date is mid-February, so I guess that's why there's not really a lot of news about him. Any links that I find, they're just gonna be under the Webcam Diaries as I'm looking. But yeah, apparently he's wearing a turtle suit or anti-suicide smock in prison, which is not the standard prison uniform. So people on social media are speculating over his safety in prison. They think that his life might be in danger and that he's being put in a turtle suit as part of a conspiracy in which he will be killed, and then it'll be looked like a suicide, like a certain other person. And it said it's from somebody who was a fellow inmate. It says his next court appearance is February 21st. There's another article where apparently he changed prison guards' behavior. Correctional institution in Huntington, Pennsylvania. And then he was extradited to New York. But apparently in the article, the person who was like an inmate when he was in Pennsylvania said that the notoriety softened the like oppression of the guards, so I guess how abusive the guards were, because they wanted something from him. And he was placed in the D block, which is typically reserved for death row inmates. Every time he was escorted from a cell, D block got locked down. He wore a turtle suit, which is a paddle padded blue garment designed to prevent self-harm. So this was when he was first in prison. So I don't know if that's currently happening now in New York. Okay, so clearing that up with the turtle suit thing. This was from somebody who was in Pennsylvania when he first was arrested. So we don't know if that's still the case in New York. I'll put his article, not like the New York Post's article, Newsweek's article, sorry, because, yeah. I wish they would clarify that like it's from when he was in PA, when he was in Pennsylvania. Doesn't look like they give that context. Okay, SCI Huntington. They did not know it's actually with a D, not a T. That's kind of funny. He has a fundraiser, Give Send Go fundraiser for his legal fees. Right now it has over $200,000 and it is almost at its $500,000 goal, which is cool. Would love to link the fundraiser. Okay. If you would like to give to him, I'm not saying you should or shouldn't. I'm gonna also put that in the description. It's under Webcam Diaries. That's all I got for y'all in that regard. Now I'm gonna get back to editing. All right, see you later. Like a little dark for some reason, but we'll make it work. Okay. I don't think. Hello. I don't know if this mic is working, but that's why we got the backup. So. Cool. Hey, it's me, Isis. Welcome back to my channel. My name is Isis, and this is IsisSaysHi. I like to make videos about research, about topics that matter to me. I really hope this works, or else I'm gonna look so stupid. I am very late to the party with this, but I'm not gonna do this the whole time. I had done research and made a script for the UnitedHealthcare situation. Truthfully, financially, it's a little bit in shambles over here. I'm doing everything I can to just make things work, but it's why I haven't really been able to come and record. So if you don't mind, I did leave a couple links down below. One is like for a shop that my family is starting to run online. And then another is like if you want to buy me a coffee, even though I'm drinking one right now, if you want to buy me a coffee or anything like that, you can also donate there. I don't know if it's a smart idea because I don't really have that many subscribers, but maybe opening up a Patreon or something like that where I can allow myself more flexibility and time to be able to make videos, because I really do love YouTube and I love making videos. I just don't have the time because I need to make money somehow. So yeah. If you hear my cats, you know the deal. Let's get into the video for real. Probably heard about the UnitedHealthcare murder of the CEO, and it's an event that sparked a lot of heated conversations about our healthcare system and its frustrations and inequities. What I want to talk about in the video today is why is our American healthcare system this way, and what would drive somebody to kill an insurance CEO? Understanding the American healthcare system is a really big key of why people's reactions were pretty whatever, pretty nonchalant, including mine. Like, we pay so much only to have to pay even more out of pocket if we have a really big financial emergency. Even though we pay to have coverage, we pay to have healthcare. Even if we pay to do that, they can still deny coverage of things that are good for your health. And then even then, you gotta hope that you can find good healthcare providers that are close by. And one of the reasons, which I learned, and I will go into my story, is sometimes the healthcare companies don't properly compensate the medical providers. And so it's just the United Healthcare system was not really, it feels like anyways, was not really meant to actually care for Americans or just people who need healthcare. It was just meant to care for CEOs and those in power. Full disclosure, I had UnitedHealthcare when I was at my previous job. I had loved it in the beginning because I was on Medicaid. At least in Long Island, it was really, really difficult to find Medicaid providers. And so when I got UnitedHealthcare, and not only was it easy to kind of sign up for the healthcare plan, but also to just find providers. My cats are playing with a toy that's inside of the basket. Frankie, you know what, whatever. I had UnitedHealthcare,
And I was really excited at first because I could have more providers. It was really great in the beginning because I just had more access to providers. And I moved to Pennsylvania. That wasn't true anymore, wasn't as true anymore. I would say like probably the second or third year when I moved, I had like severe periods, like really heavy periods. They would last really, really long. It would just be really heavy. I couldn't go into the water. Of course, this was also like during the summer and during the year where like everybody wanted to hang out with each other. And I felt so embarrassed having to say, yeah, I have really heavy periods and I can't go. And because I had already paid for everything, I didn't know that my body was going to just start to react this way. So I went to the gynecologist that I had when I moved, and they put me on a birth control shot, and it didn't work. It felt like it made it like way worse, and I actually ended up having to go to the hospital because of it. And then during that time, the gynecologist that I was going to didn't renew their contract with UnitedHealthcare because I guess they weren't paying them as much as they needed or something to that effect. And so that like kind of, for lack of a better word, that screwed me over. When I went into the office, they were like, okay, well, we can give you a good faith estimate and go from there. But the good faith estimate was way too much money, first off. And so then I had called them to see, hey, is this appointment still good? And then they told me, oh, we don't take your healthcare, you can't come in. Which is insane because I was, what in God's green earth? Was told one thing in the office, and then I call and it's a different thing. And it's just like that abrupt cut of care was one of the reasons that contributed to me going to the hospital. Not to mention the fact that I had told them like, hey, my body doesn't really feel great. Is there something else that we could do? I don't think the shot is going to work for me. They gave me birth control and that did help. But the birth control was way too much. My insurance wouldn't even cover it. Or even the generic version. It's either that or like the pharmacy was just really lazy. So it's just like I had these multiple things happening right in the healthcare system. And I have fibroids, which is what I learned later on, but the healthcare system was just not working for me, right? My body was not thriving, and I just felt so embarrassed. I didn't really explain to friends and family like what exactly was going on and how severe it was. It's like, how do you tell people your body just keeps bleeding? You didn't know this was going to happen, so you had like planned and paid for everything for these vacations, and your body is like not a fan.
I realized my story sounded a little disjointed. I had really heavy periods and really heavy, like really big blood clots. This is TMI. And I had already planned to go on these vacations with my friends, different groups of friends. And so it sucked because I didn't want to cancel those plans because one I had already paid for, and the other one I just was excited and I just wanted to go. I went with the understanding that my period was still going. I think it was the first week, and then the next vacation was the second week of my period. So again, I had my period for 14 days, a little bit longer than that, I think, after. And I didn't realize or didn't understand how severe my period was. Like the fact that I was like bleeding so much and clotting so much, I didn't understand it. Like I kept bleeding through my pants, I kept bleeding through like bed sheets. Like it didn't, like I would double up, I would do everything that I could to like stop how heavy the bleeding was, and it just didn't matter. On the first trip it wasn't the biggest issue because my friends understood and it wasn't a huge issue. On the second one, I think it caused issues because they didn't understand why I wasn't always participating as much and why I just was a little secretive and like private about things. And a really big part of that was because I was embarrassed and I didn't know how to just say that to people. That just opened a whole other can of worms because it ended like a really long friendship that I had with someone since like middle school, which sucks, but it is what it is. It also ended a relationship that I had that like was not a good relationship at all, so I'm happy that it ended. And then towards the end of the year and the beginning of 2024, so the end of 2023, the beginning of 2024, I had to go to the hospital because my blood count was so low that I think I could have died. And a part of that was because of my heavy periods. Even when I was there, they weren't really helpful. Like, they didn't really give me an alternative or another way that I could get help like, that I could stop these periods. Like, they were like, oh, you just need to get used to the birth control shot, even though the birth control shot did absolutely nothing. It felt like it made it worse, and it put me in the hospital, so obviously there's something wrong there. And they just wouldn't give alternatives, and so taking that to present day, still have fibroids. It's a little bit better controlled because I'm on birth control, a different birth control, no longer on the birth control shot, but I am running out of the birth control that I have, so I'm a little concerned because I'm also in the middle of my period. And I think once I have like proper health care again, I'm probably going to go and like see somebody about getting the fibroids removed, because I think at this point they just need to be removed. I've had these fibroids since I was like 18, and they've progressively grown and also progressively have gotten worse for my body. I just felt really ashamed that my body was acting this way and I couldn't control it, and that I was bleeding through sheets and making things difficult for myself and others. And maybe I could have been more vulnerable and vocal about it, but I felt embarrassed. And yeah, that's kind of the rest of the story. So
when I had Medicaid, or when I was on Medicaid, they covered my emergency room costs, because I had been going to the emergency room almost every year since I was 18. And so the one time I had UnitedHealthcare, they didn't really cover anything at all. Like, I'm still like overdue on those bills because I don't have the money to pay for that. It's the reason I have healthcare. I have my fair share with UnitedHealthcare, and with the system just not working for me. And even then, the system didn't really care for me either. When I would go into the hospital, especially in like New York, at the time I wasn't like, sexually active, but they didn't care. They didn't believe me. And so it was just like TMI. But yeah, it was a lot. I'm very familiar with the American healthcare system. And from insurance to the treatment, and I know that it's because I'm a Black woman, and I'm just familiar with all parts of the process. So let's talk about the origins of the American healthcare system, which I didn't know about. It was cobbled together over time, and it was shaped by private companies, state-level programs, and federal government interventions. While many wealthy countries embraced universal centralized systems in the 20th century, the US decided, no, we're not going to do that, because the US needs to do its own thing. Because, hey, we're not colonized anymore. We just colonize other people. And they decided to build a complex, market-driven model that was layered with compromises. In the beginnings, I would say either of America or just in the healthcare system in general, healthcare was a personal responsibility. You paid for it out of pocket, or a charity hospital might help you if you're lucky. This, of course, left huge gaps for the elderly and the poor. People who are elderly aren't really like dripping in cash, and people who are poor also aren't dripping in cash. So as medical costs climbed and advancements became more common, so advancements in medicine, the cracks became more challenging to ignore, and it pushed the country toward change. And one of those major, breathe. One major shift came in 1965 with the introduction of Medicare and Medicaid under President Lyndon B. Johnson, LBJ. This was the government's first big step into healthcare, and it changed everything. Medicare provided health insurance for Americans 65 and older, as well as younger individuals with disabilities, and that filled a critical gap for seniors who previously struggled to afford care. Medicaid extended coverage to low-income families and individuals, creating a vital safety net for millions who might otherwise be left behind. These programs expanded access and reshaped the system, making government funding a key player in what had been a primarily private game. But they also added layers of complexity. What in the Lord's heaven? It's like they know I'm trying to film, and they decided to act up. This is crazy. They also added layers of complexity to an already fragmented system. By the 1970s, rising healthcare costs were becoming a national crisis. The federal government's solution was the HMO Act of 1973, and that encouraged the growth of health maintenance organizations, which are HMOs. And HMOs aim to cut costs by focusing on, get up there, girl, and lay down. HMOs aim to cut costs by focusing on preventative care and managing service delivery. So it sounded great in theory, but it was controversial. It kind of standardized where and how you were going to get care and who you were going to get care from. So patients felt their choices were limited, especially when it came to specialists, and many believed their care was being driven by cost cutting rather than their need. Around the same time, private insurers became major players and health coverage became increasingly tied to employment. This meant your ability to access healthcare often depended on whether you had a job and if your job offered good insurance. Millions were left to navigate a confusing, expensive, fast forward to 2010, and then we have the Affordable Care Act, or Obamacare. This landmark law aimed to fix some of the system's biggest issues within the healthcare system. Its key features included expanding Medicaid eligibility, but not all states adopted this, creating online insurance marketplaces with subsidies to make coverage more affordable. Willow. Hey! And preventing insurers from denying coverage to people with pre-existing conditions. Crazy concept for the healthcare to care for the person who is in bad health. The ACA successfully reduced the number of uninsured Americans, but became a political battlefield with constant legal challenges and polarized options about its effectiveness. As government programs like Medicare, Medicaid, and the ACA expanded, private corporations found more opportunities to dominate the healthcare landscape. Enter UnitedHealth Group, which was founded in 1977. Starting as a small provider network, it has grown into the largest health insurer in the country. They operate in two key divisions. So they have the UnitedHealthcare, which handles insurance, and then they have Optum, which uses data and tech to drive healthcare services. UnitedHealthcare exemplifies what critics call the corporatization of American healthcare. While its innovators in telehealth and analytics have improved care delivery, the company has been criticized for focusing on profits at the expense of patients. Today, the U.S. healthcare system reflects its patchwork origins. Most working Americans rely on employer-sponsored insurance, while government programs like Medicare and Medicaid cover seniors, low-income individuals, and those with disabilities. Private insurers like UnitedHealth hold immense power over access, pricing, and the quality of care. This fragmented system comes with a lot of major costs. The multi-payer structure is expensive to manage, which drives up costs because they have to hire people to manage those systems. Vulnerable populations, such as low-income families, rural residents, and communities of color, continue to face significant barriers. And the U.S. spends nearly twice as much on healthcare per person as other developed nations, yet often ranks lower in health outcomes like life expectancy and chronic disease management. It's a system that has expanded access for some while leaving a lot of others behind. These inefficiencies and inequities fuel the frustrations that manifest in ways we've seen recently, like the murder of the UnitedHealthcare's CEO. The United States, if you didn't know, is the outlier of outliers when it comes to healthcare and incarceration and government regulation. Anyways, we spend nearly 18% of our GDP on healthcare and more than any other high-income nation. And on a per capita basis, it's over $12,000 annually, almost double what comparable countries spend. But the kicker is we're not getting more for our money. Americans see the doctor less, spend fewer nights in the hospital, and have worse outcomes. The paradox of spending more but literally not getting anything else, achieving less, raises the question of why, and it boils down to three issues: higher prices for services, medications and procedures, administrative inefficiencies from juggling multiple payers, forms, and regulations, and a profit-driven system that prioritizes revenue over equitable access. In 2022, 8% of Americans were uninsured, with low-income households and communities of colors disproportionately affected. In contrast, many other countries have cracked the code for universal access without breaking the bank. Canada has a single-payer system where provincial governments fund and manage healthcare. There's no out-of-pockets for primary care, but specialist wait times can be a pain point, which I've heard a lot from people who I knew who lived in Canada. I was about to say Canada. Germany operates under a Bismarck style, mandating insurance through nonprofit sickness funds. It's universal and fosters competition among insurers without sacrificing equity. United Kingdom relies on its National Health Service, which offers fully government-funded free care at the point of use. So how do they stack up against each other, against America? The data says that Americans live an average of 77.5 years, while people in comparable countries enjoy an average life expectancy of 82.2 years. Infant mortality rates in the US are among the highest for developed nations. Avoidable deaths, or those preventable with timely care, are far more frequent in America. Meanwhile, countries like Japan and Sweden achieve significantly better outcomes by strongly focusing on preventative care and public health infrastructure. They spend less, yet their people live longer and healthier lives. I can't tell you how many times I've been wanting to move to Sweden. A significant reason for this disparity is administrative costs. In the US, these account for 25% of all healthcare spending, nearly double the average in other developed nations. Why? It's all those payers that have their own rules and forms, so all the health insurance companies. Not to mention the massive administrative staff needed to handle it all. By comparison, single-payer systems streamline these processes, slashing overhead and focusing on resources where they're needed most, on patient care. Let's talk about prices. Americans pay through the nose for prescription drugs because there is no federal price regulation. A pill that costs $100 in Europe can cost $400 in America. Hospital stays and procedures are also significantly more expensive due to unregulated pricing and market monopolies. The upside to our spending is innovation. America has a lot of cutting-edge treatments and advanced care options. However, the trade-off is steep. Financial barriers that leave many delaying or skipping care entirely. Other countries can offer us some valuable lessons about this. Guarantee universal access to basic healthcare services. Price controls on drugs, hospital stays, and physician payments should be implemented to prevent excess. Streamline billing through single-payer or all-payer systems to reduce inefficiencies. Invest in preventative care to keep people healthier and reduce costly emergency interventions. That doesn't mean the US needs to copy any single system wholesale. We can build something that is uniquely American, because that's what Americans love to friggin' do, by blending the best ideas. Expand the public option to foster competition and affordability. Use federal negotiation to lower drug prices, as many European countries do. Increase funding for primary care, which is more cost-effective and can prevent larger and more expensive problems later. Public frustration with the US healthcare system isn't just about money. It's about fairness and access. Other countries have shown us that better outcomes and affordability are possible. So why hasn't the US followed suit? In my notes, I have that a lot of the American folks who were in the Olympics, I think they were in France this year, they did all of their medical appointments there. I think it was in like the actual Olympic Village, but they did it there because it was more affordable than doing it back in America, which is insane. I've seen countless TikToks of people going to different countries to get like a full body checkup, full body scan, not having to pay as much for it. But it's insane that people have to spend so much money to go to other countries to get healthcare for less. Like, that shouldn't be what is happening. You shouldn't have to go through all these hoops just to get proper healthcare. Key challenges in the U.S. healthcare system. We're taking a sip. The systemic challenges of U.S. healthcare go far beyond statistics and policy. They're the daily realities that millions of Americans grapple with. Let's break these challenges into 3 critical areas: affordability, access, and complexity. Affordability. Healthcare in the U.S. is infamously expensive, and the numbers paint a grim picture. Insurance premiums have soared, with family plans averaging over $20,000 annually. Out-of-pocket expenses, including deductibles and copays, add yet another financial burden. Let me tell you something, okay? I had to go to a sleep doctor because I have sleep apnea. I had called and was like, hey, I just want to know how much the copay is. The lady's like looking through and she's like, $0. Like, okay, cool. I go to the place, okay? We're not doing great financially this week. And so when I go to the place, she's like, $80. And I was like, what? Luckily, because I was trying to pretend like I had some money, I didn't have to pay $80. But like, that was insane. Like, I asked on the phone, hey, how much is it? Nothing. I go in, it's $80. That's what I mean. It's like the out-of-pocket expenses just to get care, especially specialist care. It was just insane to me. Prescription drug prices in the US are among the highest in the world, often forcing patients to choose between their health and other essentials like rent or groceries. The financial strain is overwhelming. For many, it's a pressure cooker situation that can lead to desperation. When healthcare is driven by profit, corporate entities like UnitedHealth are often perceived as villains, fueling resentment that, in extreme cases, might spiral into acts of violence. Despite being one of the wealthiest nations, the US leaves millions of people behind when it comes to accessing care, which is why they're the wealthiest. Racial and economic inequities persist, with communities of color and low-income families disproportionately uninsured or underinsured. Medicaid gaps in non-expansion states leave millions without coverage despite being eligible under federal guidelines. This inequitable system creates a lot of anger. People struggling to access basic care often feel frustrated at perceived gatekeepers like insurance companies. The barriers to coverage, whether due to income, geography, or systemic discrimination, exacerbate feelings of disillusionment with a system designed to exclude them. Lastly, complexity. Navigating the U.S. healthcare system is an exercise in frustration. Administrative inefficiencies and opaque billing practices make understanding medical costs nearly impossible for the average person. Surprise billing, in which patients receive unexpected charges even for in-network care, is a widespread problem that can leave many blindsided. Patients often struggle to understand their coverage, from what's included to why claims are denied, which can create a sense of helpfulness. There was a Black woman on TikTok who has fibroids like me, but it was like very severe, and she needed surgery, and it's supposed to be covered under her insurance. I think she had UnitedHealthcare, if I'm not mistaken, and they just denied the coverage. And her doctors were just genuinely confused because they didn't know why it was denied. And so they just kept fighting it because they're like, why are you denying coverage for this? I mean, she had to go on TikTok and add them. And then, of course, that gained a lot of popularity and notoriety. And she was finally able to get the surgery she needed, and it was finally able to be accepted by the health insurance company. But it's just insane, that in order to get good health care, to afford it, you have to publicly be so vulnerable in order to get that care. It's also insane that something can be included in your insurance but then just denied for no reason. Like, they didn't really give a reason and they kept denying it. And it's like, well, it's in my insurance. It's a life-saving procedure. Like, it didn't make sense. And it's things like that where it's like, okay, well, what is the point of having health insurance if it's not going to actually care for my health, if it's not going to actually help me afford the care that I need? Why would you deny things that you're supposed to not deny? For somebody who's already stressed by their health concerns, the level of bureaucracy can feel dehumanizing, and the perception that corporate healthcare entities profit from this confusion only heightens the public resentment. It's not just about paying too much, it's about feeling like the system is rigged against you. We put this all together. These challenges, affordability, access, and complexity, aren't just abstract policy debates, but they're personal ones. For many, they represent a daily battle to get the care they need without losing their financial stability or dignity. These challenges make it clear that reform involves more than tweaking policy. It involves rethinking the entire healthcare system and its payment structure.
It's me again. I was talking about Luigi Mangioni, but it got cut off, and because of the way that I have to edit, I am not going to go back to figure out where it is. I was talking about Luigi Mangioni. I really hope that I'm saying that name right. I'm so sorry, big dog, if I'm not. From what I understand of his story, his family was upper middle class, and he was pretty athletic, pretty good, healthy, all that, but then he hurt his back, and even though he got the surgery to fix it, it didn't really fix his back. He still had a lot of pain, and that also led to just a lot of medical expenses for having to go and get that, in just relation to that back pain. His story speaks to why folks would maybe allegedly go in the route that they go to, because it's just so angering and frustrating. He was literally upper middle class, and even being upper middle class, it didn't matter. Like, he still couldn't afford it. He had to take grants and loans from friends and family just so he could afford the medical care that he needed. And then, of course, now that he's in prison, folks who are in prison, they're first of all protecting him. They're also just like talking to him about their healthcare stories because it's very similar to his, and it's very relatable. When I think about Luigi Mangione, and it's kind of like a really, to me, a really big proponent of what's wrong with our American healthcare system. Yeah, I'm done.
And then I also think about the TikTok ban and just a lot of other things. And it's like America's obsession with profit is really scary and concerning. To just be so obsessed with making money and being rich no matter who you hurt and harm, it's a lot. It's a lot to think about, and it makes me sad and overwhelmed. And so I have to stop thinking about it. So when we look at the shooting of the UnitedHealthcare CEO, is it a symptom of systemic issues? Absolutely. While no single event can fully capture the complexities of U.S. healthcare, the shooting of UnitedHealth CEO has forced us to confront how systemic issues can boil over into public outrage. It's not just a story about one person or one company, it's a stark reminder of how deeply dissatisfaction with the healthcare system runs. For decades, Americans have faced rising healthcare costs, often without a corresponding increase in quality or access. Many families live paycheck to paycheck, and an unexpected medical bill can push them into financial ruin. Insurance companies like UnitedHealth, which had like record profits year after year, are often seen as emblematic of a system that prioritizes profit over affordability. For someone pushed to their financial or emotional limit, this frustration can turn into anger and sometimes has really tragic consequences. Widespread dissatisfaction with the healthcare system frequently targets insurance companies. These entities are often considered gatekeepers who deny claims, increase premiums, or profit from administrative inefficiencies. United Health, as the largest healthcare insurer in the country, symbolizes this corporate dominance. The perception that companies like these profit while patients suffer fuels resentment that can escalate into outrage. The U.S. is grappling with widespread mental health challenges, exacerbated by limited access to care and social safety nets. These issues can heighten the livelihood of violent acts, especially when combined with economic pressures. For example, TikTok has become a really great way for folks to achieve that financial affordability, I guess, that they need to actually live. And so when the government decided, no, well, Trump, and then the government decided, no, we're going to take it away, it was just like a shock because everybody's like, there's so many people on TikTok who have said that this helps them actually be able to live their life well. And that doesn't matter. It's just kind of insane to me. But it's also, again, emblematic of how America works. If they are not benefiting in some capacity, the system isn't going to be there for long. When people feel unheard and unsupported, the consequences are devastating. Understanding this shooting requires looking beyond the immediate act and reflecting on the systemic changes needed to address the root causes of public dissatisfaction. It also means not immediately locking people up for repeating words listed on the bullets, because that was weird. So are there any potential reforms and solutions? While there's no one-size-fits-all solution, several reform options offer a path forward, each with strengths and challenges. So we could do a single-payer system, and that streamlines costs and coverage. Like Canada's single-payer system, it would centralize healthcare funding under a single government program, ensuring universal access while significantly reducing administrative inefficiencies and waste. By eliminating the need for multiple insurers, billing systems, and pricing negotiations, the model could simplify coverage for patients and providers, lower healthcare spending by negotiating standardized prices for services and medications, and provide equitable access to care regardless of income or employment. Transitioning to a system in the U.S. would be really challenging and require a lot of planning to avoid disrupting existing coverage during the shift. We could do a public choice model. Public choice models like Medicare or Medicaid buy-ins offer a more incremental approach. These programs allow individuals to opt into government-funded insurance plans, increasing competition with private insurers and providing a safety net for those priced out of the market. Key advantages: flexibility for consumers to choose between public and private options, gradual implementation, reducing political and logistical hurdles, and potential to expand over time into a universal system if widely adopted. So instead of companies and private healthcare companies advertising the insurance to you themselves, it would just go through one system where they would have to compete to give you the best care and the best coverage with how much you pay. This is less disruptive than a single-payer system. Public choice models still face resistance from private insurers and require a lot of regulatory oversight because that means they're going to make less money. And the people in the government would actually have to do their jobs. Crazy thought. We could regulate private insurers, and that increases transparency and accountability. We don't even have to overhaul the system. We just have to regulate private insurers, and that could address a lot of the most pressing issues. This includes enhancing transparency in pricing and billing to empower consumers, capping prices on essential services and medications to prevent excessive cost, reducing administrative waste through standardized forms, processes, and payment systems. So it wouldn't eliminate the disparities completely, but it would make healthcare more affordable and accessible while holding insurers accountable. That's not going to work in America because imagine holding people in power accountable. Next, innovative state-level solutions. We cannot do that here. Leave it to the states. In America, it just has bad connotations. But anyways, some states are already testing a lot of reforms that could serve as national models. Maryland has an all-payer model, and it sets uniform prices for all public and private payers for hospital services, and that reduces administrative complexity and controlling costs. Vermont's approach emphasizes primary and preventative care, so instead of incentivizing high-volume care, it allocates fixed budgets to healthcare providers to manage population health. It's to help encourage providers to actually care for the person that's in front of their face right now. That's the best I got. These state-level experiments show that targeted reforms can yield significant improvements even with broader restraints of the U.S. healthcare systems. Some of the things that the healthcare system needs to also make sure of is addressing the social determinants of health. Reforms must tackle the root causes of healthcare inequities. Poverty, housing, insecurity, and education access directly impact health outcomes. When you invest in things like that, in preventative care and addressing those social determinants, we can reduce the incidence of chronic diseases and costly medical interventions, improve health outcomes across underserved populations, and build a more sustainable and equitable healthcare system. What's so difficult about just caring for people in America, you know? This holistic approach requires collaboration between healthcare providers, policymakers, and community organizations to make a lot of meaningful progress. A reimagined healthcare system requires bold action and collective effort, but the stakes have never been higher. Addressing these systemic issues, whether through comprehensive reforms like single-payer systems or incremental changes like public choice models, is essential for creating a system prioritizing people over profits. In conclusion, besties, the story of American healthcare is one of evolution, complexity, and growing inequity. Over decades, a fragmented system has emerged, leaving too many struggling with affordability, access, and endless complexity. Comparisons to global systems highlight better, more efficient ways to deliver healthcare. Systemic challenges we've discussed, skyrocketing costs, inequitable access, and an overwhelming administrative burden have real consequences for individuals and families. The shooting of UnitedHealth CEO, while it feels extreme, reflects the deep frustration and resentment felt by many Americans toward a system that often seems to prioritize profit over people. It's a very stark reminder of how personal and emotional healthcare is for millions. The good news is that there are solutions. There are paths forward, from single-payer systems to public choice models to state-level innovations. But none of these will happen without political will and public support. Reforming healthcare isn't just about fixing the system, it's about restoring trust and ensuring everyone has access to the care that they need. Healthcare isn't just a political issue, it's a human one that touches every aspect of our lives. And it's time to do better for all of us. I don't know what is with America's obsession of taking away people's happiness, but stop it. Do better. My battery's gonna die. Okay, see you later.